Okay, today I will be talking about plantar or palmar osteochondral disease in thoroughbred racehorses, specifically in Hong Kong. To begin with, palmar plantar osteochondral disease can be abbreviated with just POD, and it's caused by an injury to the subchondral bone after it is exposed to prolonged, frequent loading at high stress levels that arise from horse gallops. It can happen at any age horse, depending on the intensity of training, and it is also frequently seen in thoroughbreds due to their intense training at a young age. For those of you who don't know where the distal palmar osteochondral fragment is, it's right around here, just so that you have an idea of where that would be on the horse. The article that I reviewed was Horse Training and Race Level Risk Factors for Palmar Plantar Osteochondral Disease in the Racing Thoroughbred. The authors were G.L. Pinchbeck, P.D. Clegg, A. Boyd, E.D. Barr, and C.M. Riggs. And I found this article in the Equine Veterinary Journal. So to begin with, what is POD? It's a condition that is due to injury of subchondral bone associated with repetitive high strains and strain rates in bone of the distal condyles during high-speed racing and training. It's also a degenerative condition affecting distal condyles of the third metacarpal and metatarsal bones. It's very common in racehorses, again, because of the intense training. So here is the lateral condyle and the medial condyle. So these are the condyles that were studied in this article. Some causes of POD. There are many theories tested in this article, and they are as follows. Was it more severe in horses that commence high-impact training or racing as 2-year-olds? Did severity increase in horses raced over longer distances? Did severity increase with more frequent training? Did a heavier body weight affect severity of POD? Did severity increase when horses allowed more short rest periods in between racing? Did swimming as a part of a training regimen have a protective effect? Is it more prevalent in certain bloodlines? And were winnings reduced in horses with increased grades of POD? So in this study, Pinchbeck set up a grading system for POD. And it was a grade scale that went from 0 to 3. A 0 meant no evidence of POD. 1 was discoloration of the subchondral bone only with no disruption or minimal disruption of overlying articular cartilage. 2 was discoloration with mild to moderate disruption of articular cartilage. And 3 had established lesions with discoloration and disruption or collapse of the articular surface. This is an example of the table that was in the article. So here are the grades 0, 1, 2, and 3. And then here are the percentages of the condyles that had each grade and the number of condyles of each grade. And these are the confidence intervals. The layout of the study was as follows. There were 64 horses that were studied in Hong Kong. And the reason that they did the study in Hong Kong was because a lot of the tracks in Hong Kong keep records on all the horses, as well like medical records and track records and everything that could be used to establish a correlation with POD and training records. So they had detailed records on each horse and correlated grade of POD with the horse's past records, and it had to be conducted post-mortem because they couldn't tell the grade of POD in the condyles in live horses. And some condyles had to be thrown out due to acute trauma, so they couldn't really tell if POD was causing any injury to them in those condyles. There are 8 condyles per horse, and since some of the condyles were thrown out, there was a total of 1288 condyles that were studied. Some of the findings in this study: horses that have a higher probability of developing POD were horses that raced before importation to Hong Kong, or a greater age at retirement, had an increase in the number of races in Hong Kong, had an increase in the number of racing seasons, had an increase in the number of races per season, had an increase in total lifetime race distance and average race distance over career, and had an increase in the average number of between race intervals of up to 16 weeks. So obviously we can tell that the harder a horse works and the longer it works at a more intense training level, the more likely it is to have POD in the future. Horses that have a decreased probability of developing POD. These horses were they started their career at 4 years or older. They had an increase in the number of days since retirement or last race and death or euthanasia. This could also mean that it's possible for POD to heal itself, because if the horse does not have a large grade of POD, then the smaller grade PODs have a better chance of healing themselves if they have time to do so. And also had an increase in the number of between race intervals of greater than 16 weeks. There were also some variants that were tested that had no correlation. For example, import age, age of first race in Hong Kong, winnings in most recent racing season, and the horse's weight, which is surprising because we would think that a horse of a larger weight would put more stress on those condyles, therefore causing POD. But there seemed to be no correlation in their tests. So for an overview, I picked this quote out from the article by Pinchbeck. The principal finding is that POD is associated with racing and training exposures, increased number of races in a lifetime, increased training gallops in the most recent season, and horses that had raced for more than one season all increased the risk of higher grade POD. That just sums up everything, and I thought it was a good quote to put in here for everyone to read, just so they can have a short summary. There are also benefits of the study. We can correlate a lot of the causes. It can change training routines to benefit health of a horse in the future. So if a trainer knows what kind of things cause POD, they can avoid these. Further study can help find more treatment and prevention methods. This would be very beneficial in the future for trainers also. And the information gathered also leads us to believe that cumulative exercise may be more important than age at first exercise when it comes to risk for POD. So therefore, the age at which a horse first starts training is not as important as the kind of training that is being done and how long it will be going on. There were some limits to the study, however. Some horses may have been affected differently due to different types of training. So obviously, different trainers are going to train horses differently, and it's hard to tell with all the horses that were tested if they had the same type of training, because training intensity and frequency and type of training will have an effect on POD. And POD could have been contributed to by another injury. Say if a horse is favoring a leg, it might be putting more stress on a different leg, therefore contributing to POD. Also, the study had to be conducted post-mortem, and it would be a lot more beneficial to be able to conduct it while they were alive so that they could do prevention treatment. In conclusion, it's important to keep in mind the health and well-being of your horse during intense training regimens. It helps your horse perform better, and it also keeps your horse healthier and happier. Hopefully, we can have a way to examine POD in live horses in the future to help treat and prevent it before it's too late. And the information will be beneficial to educate those in the veterinary field and training community to help decrease the risk for POD in thoroughbred race horses. Thank you.